You're not getting anything yet?
I'm going to try.
One, two, three, testing. 1, 2, 3, testing.
Really excited. Thank you for having me.
1, 2, 3, testing. Can you hear me okay? All right.
Hi.
I'm sorry. Hey, how are you?
How are you?
Testing sound.
Yes. Hi, Lisa.
You're in my grand chapter.
Oh, yes, Omega. Wonderful. Hi, Sora.
Hi. What did you do?
Hey, Sora. Okay, we'll have to do that during the reception. Yes, that's right.
you.
Thank you. Yes, ma'am.
You're also
My little pink and green. Trying my best.
see your name a lot on
Thank you. Yes, ma'am. Thanks for coming. This is so nice. Our little folders. Oh, we love a packet. My team.
We do love a packet. Everyone, we had some microphone issues getting them set up, so we had a mic for everybody, but unfortunately we don't anymore. So if we can just share the wireless mics, if it's not too awkward. If not, it's obviously a small room, so just raise your voice, and I'm sure folks can hear it.
Oh gosh, thank you.
This is the wire. This is hold on. So that's for the stream, so they can hear you. Yes, ma'am.
Okay.
Okay, so I'm going to introduce Congresswoman Adams. She has to leave, right? Oh, okay, I apologize.
No chair, no pass to you.
Okay, excellent.
I'm just used to chairing everything.
Well, it says panel begins, you provide, so I thought that meant I had to start it.
Oh.
You know, try to follow the instructions.
someone will give me the get started. You know it's being get started. Do we
Yes,
say
ma'am.
that?
Mhm.
Okay.
Good afternoon. Good afternoon, everyone.
Good afternoon.
Good afternoon.
My name is Cheryl Rucker Whitaker. I am the president of SyncCare Illinois. We are proud to sponsor this afternoon's event to celebrate 5 years of the Black Maternal Health Caucus. Who is SyncCare? SyncCare has the largest network of Black and brown physicians across the country, and we're dedicated to addressing and creating opportunities for a more equitable health system and access to care for all people who need it. I know that many of you are aware of the shocking data and statistics surrounding the issue that we are gathered here about today, but I want to give you some focus from what we are seeing on the ground. Black women are 3 times more likely to die from pregnancy complications, regardless of income or education. Since 1986, Black maternal deaths have doubled, and 60% of them are preventable. 15% of Black babies are premature versus 10% overall, and preterm babies are at a higher risk for major adverse health outcomes in both childhood and adulthood. Unconscious racial bias, including lack of evidence-based, culturally relevant, life-saving interventions, contributes to health inequities for Black and brown moms and their babies. Black women across the country require accessible, culturally sensitive, and consistent whole health prenatal care delivered within their communities. This is not a choice, but rather a fundamental need that must be addressed to bridge the gap in maternal health outcomes. So how do we get that job done? Look to my right. I'm so proud today to introduce, or to pass the mic to, the co-chair of the Black Maternal Health Caucus, Congresswoman Alma Adams from North Carolina, Democrat.
Well, good afternoon, everyone.
Good
And
afternoon.
thank you so much for that very kind introduction. And thank you very much, SyncCare, for not only your participation, but your support. We appreciate it. And certainly we appreciate everyone coming out today. I am Congresswoman Alma Adams, and I'm pleased to join all of you as we celebrate the 5th anniversary of the founding of the Black Maternal Health Caucus. And SyncCare, thank you again for your sponsorship. Dr. Cheryl Rucker Whitaker for moderating the panel. Thank you so much for that. I'd also like to extend a warm thank you and congratulations to my sister Shiro, Congresswoman Lauren Underwood, for working together with me as co-chair of our caucus. Let's give it up for Today marks the first day of Black Maternal Health Week, and we are just so excited, not only about what's going to go on today and what's been going on today, but what will go on all week, and we hope all month and all year. But this week was founded by the Black Mamas Matter Alliance, and it's now recognized nationally. Our caucus and community partners all over the country are doing events this week through April 17th, so I encourage all of you to get involved. Just this morning, I was at Howard University Hospital, HU, for the Black Maternal Health Fair and Community Baby Shower. So I bring you greetings from the more than 700,000 residents that I have the privilege of representing in the 12th District of North Carolina. The over 100 members of the Black Maternal Health Caucus bring you greetings as well from them. And the Congressional Black Caucus Chair, Stephen Horswood, and 60 members of the CBC. It is a privilege to gather with you today under the collective mission to improve the maternal health outcomes for Black women in the United States. Now, for me and even for my co-chair here, we have personal stories about how we got involved here. my work began with my daughter, Janelle, who almost became a victim of this crisis. She was one of tens of thousands of women who experienced near misses with pregnancy-related complications. Her story is one I hear far too much from Black women when her physician did not take her pain seriously. I'm just proud to say that my daughter is still with me, and my granddaughter, who was a preemie, and she graduates from high school in a couple of weeks, and went to her first prom on last weekend. But the dismissal and the delay in care almost cost my daughter her life and the life of my granddaughter, Jocelyn. They're J's, they're all J's. And that experience made me think about what it means to be a mom. I'm now a grandmother. But my daughter, she's a mother to two amazing children, and she's a part of her community, currently serving as a coordinator for Guilford County Schools in North Carolina, connecting children experiencing homelessness to resources and community support that they need to succeed. She weaves the threads of so many lives together into the fabric of her community. And I thought about what happens when we pull out the threads of all of the mothers that we lose every year in this country. And that's why in 2019, I joined the youngest Black woman ever elected to Congress, sitting to my left here. Yes. So we got generations here.
Yes.
So that's really great. So we launched the Congressional Caucus focused on Black maternal health. And we aim to do three things. First of all, to raise awareness about the crisis, then to educate members of Congress, and then to find meaningful legislation solutions to improve maternal health outcomes. And so as the co-founders and co-chairs of the bipartisan Black Maternal Caucus, we developed a solution. We call it the Black Maternal Health Omnibus Act.
Yes.
That's a great name. It's all about mommies and babies. And throughout the process, we remain very intentional about centering the voices of Black women and ensuring that Black women-led organizations are consulted often. And so the Omnibus, a package of 13 bills, comprehensively addresses all aspects of the maternal mortality crisis with a focus on Black parents using reproductive justice as a guide. And so the Omnibus, a bold solution that unequivocally says that Black mamas matter. And so I'm proud to say that we made a lot of progress since founding the caucus in 2019. Our first bill from the Omnibus, Protecting Moms Who Serve Act, passed into law, and we were there in the White House when the President signed that bill. And we gained historic funding from the White House to address the crisis, and still we've got a lot to do, and that's why I'm proud to join everyone here today to continue that fight, because our mamas can't wait, our babies can't either. Thank you so very much, and I know we're going to have a productive conversation here, and I apologize that I may have to run out a little bit earlier, but thank you so much for being here, and God bless.
Co-chair of the Black Maternal Health Caucus, representing the 14th Congressional District of the great state of Illinois, Congresswoman Lauren Underwood.
Thank you so much. Good afternoon. I'm so excited to be here with all of you for the first day of Black Maternal Health Week. I want to thank Care, especially my friend and mentor, former boss, Cheryl Whitaker, and my former colleague, Ron, so much for bringing us together this afternoon to celebrate this very special occasion. And thank you so much to our other panelists, Assistant Secretary Agorin and Deputy Director Moody Williams. Thank you so much for taking the time to join us today. The Biden-Harris administration has been an incredible partner for us as we have worked together in order to solve our nation's maternal health crisis, and we are so grateful for your leadership. 5 years ago today, my sister and friend and colleague and I, Congresswoman Alma Adams, co-founded the Black Maternal Health Caucus, and what a journey it has been since 2019. I'm so proud to have reached this milestone together. We started out with 53 members, And we created the Black Maternal Health Caucus to organize around the goals of elevating the Black maternal health crisis here in the halls of Congress, and also to advance policy solutions to improve maternal health outcomes for all moms. And since then, we've grown to become one of the largest bipartisan caucuses here on Capitol Hill. Now, moms across America are demanding a comprehensive solution to the maternal health crisis. And so we looked into the data and we consulted with a bunch of experts from around the country. We talked to so many community leaders and we wrote a comprehensive solution. And that solution is the Momnibus. Now I'm so delighted to see some of those experts that we consulted and leaders that we've worked with here in the room today. Thank you so much for your partnership, for your patience, for your counsel. We would not be here without you. The Momnibus is a comprehensive package of 13 bills under one umbrella, and it's evidence-based and it's designed to address every driver, every clinical and non-clinical factor contributing to the maternal health crisis that we face here in the United States. It's designed to be a solution. It's not a study bill. It's not partially incremental to get us there. Eventually, no. We can solve this problem and we're committed to doing so, and the Momnibus is how we get this done. As a caucus, in just 5 years, we've made huge progress. We've enacted sweeping policy changes, we're expanding access to high-quality maternal health care, and we are providing robust support throughout the full perinatal period. As you've heard, we've passed the first Momnibus bill into law, the Protecting Moms Who Served Act. And we worked with Dr. Francis Collins, the immediate past NIH director, and his successors to start the Improve initiative over at the National Institutes of Health, which is a NIH-wide initiative on maternal health research. Last year, for the first time ever, we got funding for historically Black colleges and universities and minority-serving institutions to study maternal health disparities. And now that funding is rolling out to universities across the country. And the 2024 funding package that President Biden just signed into law last month, just a couple weeks ago, included $100 million for our Momnibus priorities. I mean, it's huge, $100 million. And so what this means is that we have made incredible progress. Money is going into communities, and I want you all to take that message and please share it, because so many families get the news that they're expecting, and what should be a joyous time of anticipation is often a time filled with a little nagging sense of dread because they know the statistics and they're feeling unsupported. I want people to know that together we have made progress. Funding is coming into their community. Have we solved the whole problem yet? No. But we're working on that solution and that there are resources on the way. We know that there's a lot more work to do. We know that our maternal health crisis is getting worse, not better. But after 5 years of working on this issue in Congress, I've never been more hopeful because that solution is the Momnibus. We have incredible momentum. We have bipartisan support. We just need your help to get it across the finish line. We need to pass the Momnibus now. Now, we have a unique political and legislative opportunity this year, and our moms can't wait. So the partners gather around this room. You're going to walk away with an assignment. And what we are asking you to do is to join us in our efforts to pass the Momnibus, right? So that we can provide every growing family with the care and support that they need and deserve, both during and after pregnancy. Thank you all so much for being here. Thank you for being part of this movement. And before I conclude, we do have a couple housekeeping matters. So votes are going to be called in a few minutes. When that happens, you're going to hear a series of bells. That's not a fire drill. We want all of you all to stay, but Congresswoman Adams and I are going to have to go over to the floor, cast our votes, and then I'll be here for the reception that begins at 5:30 this afternoon in the same room. But you are going to be in such great hands with Dr. Whitaker and our experts here from HHS. We're so grateful. Thank you for being here with us today.
Thank you so much, Congresswoman Underwood. Let's jump into the panel and meet our remaining panelists. And we're going to start with Melanie Agorin, Assistant Secretary for Legislation, U.S. Department of Health and Human Services. Melanie, can you tell us a little bit about yourself, who you are, your role, how did you get here?
Thank you. So as said, I'm Melanie Gorin. I'm the Assistant Secretary for Legislation at the Department of Health and Human Services. I got here actually from the building next door. I spent, before becoming the Assistant Secretary at HHS, I actually spent my time serving members of Congress like Congresswoman Underwood and Congresswoman Adams as professional staff for the Committee on Ways and Means, where I was really proud of the work that we did to talk about healthcare at large for all Americans and increasing access and continuing that. I want to thank, and I'm going to pass this, I want to thank the Congresswomen for their partnership, both in my current role and my previous role. One of the great honors I had as a congressional staff member was getting to work hand in glove with the Congress and their teams to advance policies, and the leadership of these two women has been inspiring, and their staff are smart, and you should know that too. I want to thank Deputy Director Moody Williams for her continued commitments. One of the things that a lot of people don't know is that HHS has 90,000 employees. Most of them are career employees with really long service to the American people, who make sure the programs that are funded by Congress become programs that can be done in communities. And it is that consistency and that commitment that really makes sure we are delivering healthcare to the American people. I want to thank my colleagues at HHS, including Secretary Becerra, whose wife is a high-risk OBGYN, so these issues are on the forefront of his mind. They're at his dinner table. They're often at the conversations that we have at the staff level. And I want to thank Sinclair for their support of this event, because one of the things that is so important is both bringing community but also bringing education to the halls of Congress to make sure that we can advance legislation and advance the initiatives of the government.
Thank you. Jean Moody Williams, Deputy Director, Center for Clinical Standards and Quality, Center for Medicare and Medicaid Services. Jean, introduce yourself. Tell us a little bit about what brings you here, your passion about this work.
So thank you so much, and it is really my pleasure to be here. And I would really like to thank Congresswomen Adams and Underwood for the dedication and for really moving things forward. As you said, not just another study. I happen to be the mother of 3 daughters of childbearing age, one of which just delivered 8 weeks ago.
Oh, wow.
And so, and with all that I do and all the time that I spend, she had complications and a premature daughter. But there's so much hope on the horizon because of the work that we're all doing in this room. And it seems like at some point or another, I've spoken with many of you in this room. And as the Deputy Director for the Center for Clinical Standards and Quality at CMS, in my role, I am very much responsible for ensuring that we have quality measures and value incentive programs and standards and conditions that facilities must follow for health and safety and well-being of all. And so all of those levers have to come into play as we work to improve maternal health.
Wonderful. Let's start with kind of an overview question. And Congresswoman Underwood, I'm hoping you'll be able to answer this one before you leave. What strategies have proven to be, in your opinion, the most effective in advocating for improved maternal health?
Thank you for that question. Undeniably, the most effective thing that we can do is tell our story. All of us have a story. Why? Because our nation's maternal health crisis has touched every corner of this country, every neighborhood, every block, every row probably of this room. And our stories are different, and oftentimes our healthcare system treats us individually, like you did something wrong, there's something that went wrong in your case, instead of taking this systemic approach that says something's deeply flawed in our healthcare system if we can't keep our moms alive in 2024. And so I really just lean in on this storytelling piece because there might be some really prominent names that we know that are connected with this maternal health crisis, but it's our individual stories, our individual testimonies as we connect with policymakers that really makes that difference. The other thing that I would just say is that we've come to understand in our conversations here on Capitol Hill that the name Black Maternal Health Omnibus Act has caused some policymakers to think that this solution doesn't help their communities. They think that this is for somebody else, someplace else. And what we know, because the data tells us, is if we can improve the quality of care and outcomes for Black moms, it improves the quality of care and outcomes for all moms. And so this is not a phenomenon that only impacts moms of a certain racial background in urban areas. This is something that touches the lives of moms across the country, urban, rural, suburban, touches moms no matter where they choose to deliver their babies. It touches moms no matter what language they speak at home, what level of education they have, right? If they did everything right, they can still be more likely to die. And I think that those stories will get us across the finish line. But I would just really encourage everybody as they reach out as an advocate, even if it's uncomfortable, maybe stirs up some difficult memories, even if you're getting some, I'm really bored and I only took this meeting as a courtesy energy from that policymaker on the other side. Y'all know what I'm talking about. To just be bold and take those few extra minutes, because it's that emotional connection, the undeniable humanity in your stories that allow us to make this change. We have made so much progress because we've been in folks' face. We haven't disappeared and gone away. This is not a fad, it's not a trend, it's not a topic du jour, it is a reality that we have insisted be part of the mainstream conversation, and we can't back down now.
Thank you. Jean, Melanie, you want to take us out of that question?
So I think it's just really important, as was mentioned, and I stated earlier that I've probably had meetings with most of you in this room, with the administrator, Chiquita Brooks for sure, and it is your voices that have made such a difference in the work that we do and the policies that we come forward with. And so I agree, the more that you're there, you're telling your stories, and also for us, commenting on the rules that we put out, because that is one of the most important things that you can do to help us push forward on policies. And we read every single comment, we're obligated to do that, and we address them. And when we don't hear your voices, we hear other voices. And so it really determines which direction we go into policy.
Jean, practically, you go to the CMS website and you sign up for what to get those rules? How do you figure that out?
Yeah, I know everybody looks for our rules and love to read the 2008. But what we try to do is really make sure to inform and send out on listservs when we think there's something that is really going to be of importance. Like when we sent out the birthing friendly, which I'll talk about designation, I'm hopeful that most of you in the room got that listserv. So we try to be proactive in our approach to letting folks know that there is something out there you might be interested in.
Melanie, what strategies do you think have been proven to be most effective in advocating for improved maternal health?
I mean, I will agree with Congressman, with my colleague, sharing your stories, but also showing where those investments are, coming back and talking specifically about how, from an HHS perspective, how federal dollars are being used in your community, how federal dollars are being used to improve and have direct income, right, or direct outcomes. I think a lot of what is often heard is, oh, the government doesn't do anything. Why are we investing in this? So the more we have to share, these are the outcomes that are there. This is making a direct impact on even one patient's life is a really important part of that. The other thing is I would encourage your states to partner with the secretary. One of the things that we launched in February is a maternal health collaborative with states to really, we can talk about dollars, we can talk about programs, but we also need to talk about those partnerships. The federal government are one part, states and local communities are the other part. So really bringing that partnership together and seeing us as partners will make a big difference in what happens in local communities.
Thank you. Here's kind of a hard question.
Yes, we do.
There are stark differences in how the Black maternal health crisis is materializing in different parts of the country. You know, in some countries, wow, there's big voices, there's a lot of organizing and advocacy, and maybe less so in other states. How do you think about, you know, when some areas are missing in action from an advocacy perspective, even though their numbers are saying, hey, the women in your community need help?
Well, I think that there's a few dynamics that have gone on. First of all, the politics on this issue have changed dramatically over the last several years. So for example, the Affordable Care Act is more popular than it's ever been. Okay. The Medicaid, postpartum Medicaid expansion, we're up to 46 states, 47? 45, okay, yes. So we're getting close to getting full participation, and these states that have been resistant to a larger Medicaid expansion as made possible under the Affordable Care Act really understand the opportunity to extend full year-long postpartum coverage to moms, right? And are choosing to take action in a bipartisan way to do that. And I think that even in these places where there might be maybe perceived political blowback or maybe a more quiet advocacy campaign, policymakers understand the language of money. And when there is grant funding that can come into their communities to help improve the quality of care, to bring additional healthcare providers, which everybody wants. Listen, I represent a very rural community. I have multiple counties in my congressional district that don't have hospitals. And so when we talk to some of our small town mayors, our rural county board chairmen, and we talk about applying for federal dollars for new hospitals, new clinics, and recruiting healthcare specialists to our communities, they get animated, they get excited. They know what that means for the possibility for growth and success and health and well-being in their communities. And so what I would say is even if that policymaker is maybe giving you a cold shoulder as you reach out as an advocate, or your local press doesn't really understand the nuances of what's going on in your community, there is an opportunity to engage with like-minded partners. And what we have found is that there are many companies across industries, not just healthcare, who are interested in working together to end our nation's maternal health crisis. We are really grateful to have such a company led by Cheryl Whitaker in Illinois, ThinkCare, but we also know that there are many companies across sectors, and that's another opportunity where those executives can get into spaces that may be closed to grassroots activists. Doesn't mean rightfully closed, but we just are facing a political reality, you know what I mean? But we can work in partnership together, and that's what we've done here with the Black Maternal Health Caucus. My attitude is this: I don't care why you join our caucus. And people come from all different backgrounds, ideology, persuasion. We have folks in our caucus who never sign on to any bills, but they care deeply about this issue, and they want to have the conversation about solutions. Great. I am grateful that you are willing to stand up and say this is a problem and let's solve it, right? And if we kind of take that approach to some of the legislative solutions, whether at the local level, thinking about what we can do as counties, or what a whole state or city can do to solve this problem, I think that we'll continue to see tremendous advancement.
Yes, so I want to speak briefly about a federal program, so a national approach to addressing local issues, and that is with our birthing-friendly designation. And within that, it started a couple of years ago as just an idea in which we were going to encourage healthcare facilities to improve their quality of care. And by joining the state-run or the regional or local collaboratives that were really working on issues of hemorrhage and hypertension and gestational diabetes and all the things that come as complications. And through that, that small idea, when we proposed it and we talked with many about how we should go about doing it, we put out a proposed regulation, you commented, and we finalized it. And we now had our first reporting cycle just this past year with over 2,200, in just that short period of time, 2,200 hospitals that signed on that we are going to commit to improving maternal health care. Now what we also did was develop a heat map so that you could see where the folks that had signed on were located. And you could see where they weren't located. And whenever you do that kind of public reporting, it does create that sense of, well, let's take a look at this and see why my area is showing up as not having what's needed. Now, sometimes it was they just weren't participating. That was really not the case in most instances. It could be that there were facilities that don't even have labor and delivery services, and then that shined another problem that we have in the country.
I mean, I think I want to sort of highlight that it really is this local-federal partnership, and thinking about all of the places where healthcare is delivered, whether that's through FQHCs and HRSA, which is the primary source of care for many Americans. It's the first place you go for questions. It's the people that know.
You want to define what an FQHC is?
Sorry, Federally Qualified Health Center, and it is a program that is funded by our Health Resources Services Administration. I want to take a class with Congresswoman Underwood, because you did a great job explaining bells. You reminded me not to use acronyms that are so normal in DC. Now I'm embarrassed, I should know better. Anyway, so federally qualified health centers, community health centers, they are often what knows the community, responds to the community. They receive funding from our Health Resources Services Administration, but also they are part of a network within that. One of the things that I think is also really important is it's not just looking at somebody within their birthing status, but their whole life experience. We were talking before we got on the panel about transportation barriers, but also thinking about what does this mean in terms of caregiving? What does this mean in some terms of behavioral health, mental health? How can communities bring other resources to bear to fully support a growing family, but also to demystify some of the points of access that seem a little bit intimidating when getting there. From a perspective, I want to highlight again the 45 states, DC, and the Virgin Islands that have extended Medicaid. We look forward to working with other states. We also look forward to working with other states as Medicaid expansion. As Congresswoman Underwood said, you know, the ACA, when it was passed, was very politically divided. We had a lot of states that did not do Medicaid expansion. I think one of the great things is watching states and local advocates really say, this isn't about politics, this is about getting the healthcare we need. And slowly, we've seen a lot of reticent states come to CMS and work through how do they do Medicaid expansion in a way that meets their community's needs. And we look forward to partnering with more states in that.
So let's talk a little bit about mental health and substance abuse around the maternity period. You know, certainly it wasn't hemorrhage was kind of the number one reason that women, you know, expired in and around childbirth, but substance use related conditions, and then also the sort of mental health part of it. Sometimes they coexist, are really increasingly a part of the landscape here. What are your thoughts here about how do we improve those services? Have you seen opportunities that look like they're scalable opportunities to improve outcomes, or at least people's access to treatment if they're dealing with those issues? I keep letting Congresswoman Underwood go first because I think she might dash out of the room. That's the only reason why I'm favoring you. But we'd like to go first here, and then I'd love to hear from all the panelists.
Well, I'll just say that when you look at the data and you combine the death rates related to suicide and overdose, the category of mental health, behavioral health, and substance abuse is now the leading cause of maternal death in our country across demographic groups. So that means including Black moms. And you know, there's a certain stigma that's been associated with moms in crisis during the perinatal period. So part of, I think, the need for reform comes with, we don't have enough providers, specialists that are equipped to care for moms beyond postpartum depression. I think culturally in this country, the average person knows the signs to look for in a neighbor or sister or friend, a loved one in that postpartum period that might be showing signs of depression. But if there's an anxiety disorder, if there's an addiction, oftentimes there's not those community-based resources, certainly not in every community across this country. We also know the data tells us that if there's a suicidal thought involved, the time between that ideation and action is often shorter for postpartum moms, right? Which means we have a much narrower window for an intervention, which means if we don't have that provider or that safety net in any given locality, we're more likely to lose that mom. So we're taking action through the Black Maternal Health Caucus. We have a bipartisan bill called the Moms Matter Act, which invests in more maternal mental health providers so that there can be these specialists in all of our communities. I think that's a really important part. You all may have seen an article about a year ago in the New Yorker about postpartum psychosis and how that is a growing phenomenon in our country, and the challenging intersection with our criminal justice system is one where I think we're going to need to take a hard look in many of our states about the way that we are basically criminalizing moms who have real acute, maybe even isolated healthcare episode, and then the long tail of being able to get access in custody of their children once again is, I think, a larger thing that we have to tackle in terms of policy. And then the last thing I'll say is this: there has been an explosion of what I think they call femtech, so these apps that are available, Count Your Kicks apps, is what I have, the baby blues or something else, just to sort of help people. We do have a hotline. I don't know if I stole that, if you're gonna raise it, so I'll leave that for you to talk about the hotline, but there's these new resources that are available. Those resources only work if we use them. And so this is an invitation to normalize downloading those apps. If you have a loved one in your life who's expecting, maybe just casually having a conversation about being there to support them if they end up facing a mental health challenge in the postpartum period, and then to celebrate the new drugs that are now commercially available in hopefully a more accessible form. If I could just say, because I think we have some insurer friends in the room, please make sure that we have coverage for these new treatments, these new clinical modalities, so that when we encounter postpartum depression, they can actually get treatment, because we know that that's a problem right now. So there's a lot of innovation happening, certainly over the last 5 years, a lot of innovation, but we want to make sure that it's equitably available. The apps, the treatment, the providers, and we have some work to do.
That was the perfect handout. So about a year and a half ago, almost 2 years ago, HHS in partnerships with states launched 988. It is a 3-digit number similar to 911. It is available both voice, text, and chat. I feel like this is my public service announcement for everyone. We are meeting people where they are. There's also language services, so that it really is, what is the best way to get that point of care? So that is one of the things that is available. I think it's other federal programs and how they work together. At HHS, our Office of the Assistant Secretary for Health and our Substance Abuse and Mental Health Services, otherwise known as SAMHSA, have started a task force looking together how to blend the resources that are there, how to think creatively. I was on a site visit at a rural hospital where they actually talked about using the state opioid response dollars, which are other dollars that go to states, to support women during their delivery and post-delivery, to make sure that they don't go back to using when they go home and are hitting a place of struggle, right? Are going back to, and so how do you do a whole person supportive, whole family supportive birth, as well as that first, right, postpartum period where you just want things to be easy. I would like to say now that I have an 18-year-old, I still just want things to be easy, but those initial days where you look for the comfort, you look for your coping mechanisms. So, but if you take one thing from here, please share 988, not just with people postpartum, but really at any point it is there to meet anyone who calls in the times that are needed.
Thank you, and I think I'll go back to kind of where we started our sharing the story. There continues to be stigma associated with behavioral and mental health issues, particularly in the Black community. We don't talk about it. And I think we've made great progress in the past couple of years, particularly with the athletes and some other respected individuals who are openly discussing their stories and how they've gone about getting mental health. And I see now, even among some of the folks that I work with, that there's more discussion that's happening. And so sharing that information about how to get help. And we know, I'm going to go back to the extended postpartum period coverage because it really, it's been shown that those with lower levels of education and individuals in the Black and Hispanic communities with other existing comorbidities didn't get the postpartum care, and so it wasn't always recognized that there was a need for mental health services. Now you have this longer expanded period of time where those kinds of things not only can be assessed, but then there's services that are provided and there's coverage for it through the Medicaid expansion. And the last thing I'll say is that one of the, COVID had so many tragic incidents, but the innovations that came out were just terrific. And at CMS, we were able to implement the use of telehealth, particularly for behavioral health services in the home. And for those that have access, and not everyone has access to the equipment that's needed to access that, that's something else we need to work on, but they don't have to leave their homes to get care. And so that really has been helpful.
Thank you. I'll ask one more question, and then you can answer a question that I didn't ask you because you have something you want to say. So, how can policymakers and healthcare leaders collaborate to address some of the root causes and improve health equity? And I'm asking, both of you are kind of in the policy realm, and how do you need us to collaborate with you as healthcare leaders? And then if you could give us a charge when we leave here, what do you want us to do next?
Well, okay, I'll start with that. I think it's not if, but we must work together in order if we want to see meaningful change come healthcare policymakers, those interested parties, and most importantly, those with the term now, we use lived experience. So speaking to those that have know best what the issues are so that we can address them together is going to be extremely important. And then you asked the question, so how do you get involved? I think we have to make it easier for you to get involved and to be able to have your voices heard, particularly as we start to look at things that make change, like incentives and dollars and programs, as we said, public reporting. So what are those quality measures that we should be reporting on that you care about? How do we get to the point of respectful care? We're struggling with finding the right way to measure that. And I know some of you are working on how to measure that, but we've been working on it for quite a while. So we need to expedite some of that. Coming and sitting in our technical expert panels. Oftentimes we do get the physicians and the clinicians that come, but really you're the experts, and we need to get your voices heard as well.
I think sharing your expertise, sharing your lived experience, whether that is as a patient, a provider, a loved one, those really do drive policy. And it is both sharing it with members of Congress, with their staff, getting to know the local staff for your member of Congress, bringing them to see what happens on the ground. There's a limited view you can have from this beautiful corner of Washington, D.C. But really sharing that. And I think from the Department of Health and Human Services, besides writing comment letters and sharing that, really making sure we understand what happens when we make a policy, when we bring that to your local community. Because one of the great parts, I will say, having sat on both sides of being on the regulatory side, is they can get updated regularly. It doesn't require a vote from Congress. It requires new information, new understanding, ways of moving the conversation forward. It's a lot more dynamic. I'm glad the members of Congress are about, but it's a lot more dynamic, and it is something that can happen in a way that reflects what is really happening on the ground. And if we are doing things that aren't working, please tell us. Because sometimes what works and what was a great idea and a story that was shared from Washington, D.C. or from Harlem may not be working in rural North Carolina.
Melanie, how do we tell you that we didn't think it was a good idea? How do we communicate with you, or do we communicate with our congressman?
That's a great question. Communicate with your congressman, but
Do we
also...
put it on TikTok?
Do not put it on TikTok, I don't know how to use that. No, so when CMS or HRSA or anyone asks for comments within regulations, within guidance, you can also write a letter. You can use the organizations that you are part of to work with as in partnership with us. There are lots of ways to share your story. We have regional directors in every region of the country who really, if you don't know your regional director, find me and I will get you their name. Because they are important. They are our eyes and ears on the ground, and there are 12 of them spread throughout the country.
That's a really important piece of information. So there's regional directors for Health and Human Services.
There are 12 regions for the Department of Health and Human Services. This is like a test. There are 12 regions, and they are spread throughout the country. There is a regional director that leads each of them and their staff, and they are the secretary's eyes and ears in community engagement. They are partnering with local organizations. CMS has regional staff. We are not just headquartered at the brutalist building at the bottom of this hill, which if you'd like to see the preeminent piece of brutalist architecture in the United States, you just go down the hill, look to the left, past the pretty fountain. But we are not just there. We are throughout the country. We are in communities, and we want to hear from your community.
Any top priorities going forward for maternal health equity for all women, really, and Black women in particular?
I mean, I will say that not just for maternal health outcomes, but really the priorities of the Biden-Harris administration are increasing access, improving care, improving affordability, and making sure that individuals have the care that they need when they need it, and that we are removing barriers to that.
Yeah, I think I started off talking about the levers that we have at CMS, and I mentioned the quality measurement and the public reporting. We are also looking to see how we use the other levers. For example, we just released the Transforming Maternal Health model, which is really going to be supporting Medicaid. It's from our Innovation Center, supporting states as they look to implement better services for pregnancy, beginning prior to pregnancy, during pregnancy, and post in childbirth through a value-based care model. And the way that this particular model is set up, it gives you an opportunity to get technical assistance, and then maybe some upside incentives, and then moving into the whole value-based care. So that's one thing. And then the other thing, I think it's on the unified agenda that we're looking at how to look at our conditions of participations in a different way. And as many of you know, that is one of the most, the type of regulation that does get attention because it impacts your Medicaid and Medicare payments. So really holistically looking at kind of the whole, the Vice President encourages us to look at a whole of government approach, and we're looking at a whole of CMS approach to see how we can really use all the levers available.
To answer my last question, so there was one program I didn't talk about that I would love to highlight.
Go right ahead.
Because this is something that is new to HHS, and we don't talk about a lot, which is actually the advanced research program that's like so it's called ARPA-H. It is similar to DARPA, which founded the internet, and we can go back to TikTok. But ARPA-H is really about innovation. And one of the places they chose to focus in their first 2 years is actually on maternal health outcomes. And it is so it is not just where are we investing money, but it is how do we think about this in an innovative way? How do we think about things from a slightly different lens, from that innovation, doing things fast, breaking things, which is not something the government is really known for. And so ARPA-H launched the HEROES program, and it is really looking at how do we provide the incentives around better health outcomes, specifically around maternal health, outside of CMS programs.
How do you find out more? Is there a website?
It is arpah.gov. I'm looking at my colleague. I will make sure that you have it, so that if you just Google ARPA-H, it is led by a really dynamic, wonderful leader at HHS, but the HEROES program specifically is looking at something, it's not building a new widget. They also have a thing where they're implanting new eyeballs, that's great, but this is really, meeting people where they are and improving communities.
Anything, Jean, that you didn't get a chance to mention as we wrap up?
No, I think you had excellent questions.
Well, this has been an amazing, just about an hour. I knew it would pass very quickly. I want to thank everyone for joining us to celebrate 5 years of the Black Maternal Health Caucus. In their absence, I want to thank Congresswoman Lauren Underwood, Democrat of Illinois, yay. Congresswoman Alma Adams, Democrat, North Carolina, yay. Co-chairs of the Black Maternal Health Caucus. I want to thank Jean Moody Williams, Deputy Director, Center for Clinical Standards and Quality, Center for Medicare and Medicaid Services. I want to just say CMS, and then Melanie Gorin, Assistant Secretary for Legislation, U.S. Department of Health and Human Services. Thank you all so much. Thank the panelists. Thank you all for attending. We have to clear the room, but we hope that you'll join us back at 5:30 for a reception. So they're going to turn this into, I think, a reception site for us. We look forward to you coming back. Congresswoman Underwood and Adams are coming back, as well as I think some of the other legislators. So we look forward to interacting with you then. Again, thank you so much, and thanks for being here.
Appreciate it. Thanks so much. Yeah, no problem. We were going to do potential interviews this time. It's not for any press, it's for us internal. Okay. Just check to see what she says now. They get all your questions back to you, you were like, get them, Ron, bam, 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 bam. Here, boom, boom, boom.
Yeah. Just like to make sure everyone.
It's copacetic, yeah. I just left HHS just last year, so I was at Aspen about 3 years beforehand. So
awesome.
I know how to do the whole thing. It's like, is this person gonna be crazy? Is this gonna go well? All that good stuff. Yeah.